I'm involved in repurposing with a company called Numedii. I'm the Chief Scientific Officer, and our mandate is to find new uses for existing drugs.
And why do you think that repurposing is important?
Repurposing is important. Naturally, it's going to save time, it saves dollars for bringing drugs to patients in a more expedited fashion.
And what is the big problem that you think repurposing solves?
Repurposing really solves the dilemma that's within the biopharmaceutical industry of how long it takes and how much it costs to develop drugs.
And for the Cure Accelerator, what is your hope for the future?
My hope is that the Cure Accelerator will bring the stakeholders together. I mean, there's many different stakeholders interested in repurposing. For example, the biopharmaceutical companies that have assets that may be shelved on their pipelines, on their shelves. Companies like us who are trying to find new uses for those drugs, the patients, the advocacy groups. And so these different stakeholders that are interested in repurposing.
Great. And what role do the stakeholders play, and should they play on the Cure Accelerator?
Every stakeholder should be represented in the Cures Within Reach group as a whole. The different roles. Give me an example.
So there's the funding, and then there's the research, as well as the companies like yours that would benefit from both of those. All of the players coming together on the Cure Accelerator.
So the different stakeholders who are interested in repurposing would include patients. Naturally, they have an inherent interest in finding medications for their particular ailment. Would include the foundations that represent those patients and also provide some funding sources. Would include the biopharmaceutical companies that develop the drugs. Would include groups like ourselves who have some technologies that allow us to find new uses for existing drugs. So collectively, they're critical.